Cosmetic surgery not only being used to look better these days, other reasons that people are going under the knife.
Younger is one of the reasons why people are getting cosmetic surgery, but a new survey of plastic surgeons nationwide finds an interesting reason why people are choosing cosmetic surgery: to compete in the workplace. Joining us now are Dr. Randall Weil, a Bay Area plastic surgeon, and Gina, one of his patients, who says that her self-esteem improved dramatically after having some surgery. Thank you, both of you, for joining us.
Thank you.
Dr. Weil, let's start with you. Talk more about this this survey and this information.
Well, it's a fairly common knowledge thing that that there are a lot of people in the workforce now. As the workforce is getting older, people are competing against younger individuals. And so a lot of the people that I see in my practice really want to maintain a youthful appearance in order to compete against some of these people.
Gina, how did you find that to work for you?
In my line of business, it's very necessary. I'm a country events promoter for country concerts and country dances throughout the state of California. And as I get older and the crowd stays 21, I feel that I need to look good and be energetic, and to have had the plastic surgery makes me feel good. Therefore, I feel that I can compete in this young market.
What kind of surgery did you have?
I had a neck lift.
Okay.
A minor neck lift.
And that was really all it was you just felt older right here?
Right. I felt that I didn't really age here, and I wasn't aging in my face, but I had what I call the rooster syndrome going on, where I had all this extra skin, and you would look at me and my neck was just like a rooster. And I felt that it was making me look older, and I would walk around like this. Oh. So I didn't feel self-confident. So now that I have this, I'm even going to cut my hair because I want to show my neck.
Show it
and
off.
I was telling Dr. Weil the other day that I hope I'm not talking to people with my neck because I'm so proud of it.
Why not? Be proud of yourself no matter what. Dr. Weil, one thing that I think about, though, and also kind of comes to light with this new Nip Tuck TV show.
Right.
That is about cosmetic surgery. Do you have a psychiatrist at the office, or do you have psychiatric training to know that this will help patients like Gina, but maybe even the cosmetic surgery can't help some people because of the problems that they have more deeper within?
Oh, I think so. But usually, I mean, 95 to 99% of the people are pretty straightforward, like Gina. You know, these are people that just want to get back into the workforce or just want to feel better about themselves.
Okay.
And we can pretty much tell ones that you probably shouldn't operate on.
Okay, we've got some before and after pictures. Let's take a look at some before. Bring them up. Okay, so what are we looking at here?
This is a woman who's in her late, she's about 57, 58, and she felt she just looked old. She was a hairdresser, esthetician, and she didn't like the jowls and the look of her neck. Felt she looked very tired and worried, which is a very common thing that I'll hear.
Sure. All right, well, let's see what happened after.
Afterwards, now this is what we call a facelift, and this is a procedure that is done, usually takes people about 10 days to 12 days to recover, but it's a facelift, a little bit more than what Gina had. Gina had her neck done, which is, we do sometimes minor procedures on people too.
That looks substantial. She does look exceptionally
younger. You know, she felt she lost 10 or 15 years on her age.
Any other, do we have any other before and after shots? Yes, okay, let's go with another one. This is an eye.
Yeah, there's a woman who's in her 40s and felt that her eyes were getting smaller. She used to get compliments on her eyes. She didn't anymore. She had very pretty blue eyes. And a very common situation where the eyes just start to get heavy.
Okay, and after? Voila.
Yeah, just an opening up of the lids. And so this is an upper eyelid procedure. Again, fairly small. Usually takes about a week to recover.
And how much would this eye procedure cost?
This runs about $3,000.
Okay, $3,000. What about jowls?
The jowls, if we just do some of the mini procedures, they run usually around, Gina's procedure would be around $5,500 to $6,000. If we do full facelifts, they might run about $10,000.
Okay, and of course, insurance says you're on your own
Absolutely,
on this.
no way.
Okay.
I can vouch for that.
Yes, you can. Well, it's worth it, obviously, to you. Thank you so much for joining us.
Thank you.
It's nice. It's always interesting to see the
pleasure.
before and the after pictures.